Are we good? Bismillahirrahmanirrahim. Nahmaduhu wa nusalli ala rasulihil kareem. Respected brothers, sisters, elders, friends, colleagues, scholars, thank you so much for joining us. Jazakallahu khair. May Allah make this time productive and make it a means of benefit for all of us and the whole of mankind. I'll introduce you to the panel. We've got everybody here. I'm really grateful. First of all, to Moulana Ayub, Imam of Masjid-e-Falah, Preston. He's going to do a quick segment just to give us some good advice, some good guidance. My name is Mubeen. I should introduce myself first, actually. So my name is Mubeen. I'm part of Preston COVID Response Group. 30 seconds about our organization. We started around about the start of the pandemic just to advise the community, advise Masajid in and around Preston. So this actually session has been through the fikr and the worry and concern of a lot of members of the community who wanted us, for many months to deliver something like this to expel some, misconceptions, misinformation, disinformation. So, moving on to the panel, we're really grateful for them for joining us today. We've got Dr. Arif Dasu. Dr. Dasu is the principal GP of Avenham Surgery. So member of the community, also member of Preston COVID Response Group. And then we've got Dr. Munir. Thank you so much, Dr. Munir, for being here. Dr. Munir is from Lancaster. He's at the University, a virologist. He's been doing back-to-back webinars, very busy man. Thank you so much for joining us. And last but by no means least, we've got Dr. Sakthi with Lancashire County Council. He's with the Public Health Department, our very own Public Health Director. Thank you so much for your time. And I'll give some time to Moulana Ayub, if you could start the program. Please enlighten with some of your words of wisdom. Jazakallahu khair.
Jazakallah Abdul Mubeen for allowing me the opportunity to speak to our listeners. Alhamdulillah, alhamdulillah wa kafa wa salamun ala ibadihi alladhina istafa amma ba'd. فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل لن يصيبنا إلا ما كتب الله لنا هو مولانا وعلى الله فليتوكل المؤمنون ما أصاب من مصيبة إلا بإذن الله ومن يؤمن بالله يهدي قلبه والله بكل شيء عليم ولا تلقوا بأيديكم إلى التهلكة وأحسنوا إن الله يحب المحسنين. My dear respected listeners, 2020, since 2020 January, the whole world is talking about the coronavirus, the plague, the pandemic, which has gripped the whole globe. This virus makes us humble, and it makes us realize that we are not all that powerful, and no human is superhuman, and we are all under the control of the Almighty Allah, the All-Powerful. We are all terrified. The humanity is petrified, terrified of what? Of the smallest of the small virus. In fact, the scientists even wonder that if it's alive or if it's something between life and death. We can't even see it without microscopic lens. To see it, we have to magnify it about 100,000 times. This virus also shows us that we are not the masters of our destiny, and yet we are not humble. How come we are not humbling ourselves in front of the Lord Almighty Allah? Allah subhanahu wa ta'ala says in the Quran, وَيَخْلُقُ مَا لَا تَعْلَمُونَ. And Allah ta'ala creates that what you don't even know. وَيَخْلُقُ مَا لَا تَعْلَمُونَ. So we know this virus is highly contagious, and it spreads from human to human by physical contact, by sneezing, by coughing. Therefore, we are advised by the medical health practitioners that we have to keep a safe distance. We have to wear a mask, and we also have to wash our hands and hand sanitize. We have to take all the necessary precautions. And taking precaution is also in our beautiful deen, the religion of Islam, also instructs us and commands us that we should take all the necessary measures in saving ourselves and our loved ones and the rest of the humanity. Allah subhanahu wa ta'ala says, وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ, and do not throw yourself in the path of destruction. Do not go into the path where it is harmful to you. Very famous Arabic saying is, نَأْخُذُ بِالْأَسْبَابِ وَقُلُوبُنَا مُعَلَّكُمْ بِرَبِّ الْأَسْبَابِ, that we will take all the necessary measures and means, but our hearts will be attached to the creator of the means. Also, our religion stipulates that we have to take precaution before the disease has taken place, and also we have to take precaution when the disease is widespread. And how we will take precaution before the disease takes place is, first and foremost, Allah subhanahu wa ta'ala instruct us, كُلُوا مِنَ الطَّيِّبَاتِ مِمَّا رَزَقْنَاكُمْ, eat from the purest of the pure what we have provided for you. Now we all know one of the reasons for this disease to spread is that some people ate prohibited things. So first and foremost, we have to ensure that we are eating halal and tayyib. Kulu min at-tayyibat, eat from the purest of the pure. And also, subhanallah, how many times we do wudu? At least 5 times a day we do wudu and we wash our hands. In addition to that, we wash our hands when we are eating. We wash our hands when we have finished eating. We wash our hands upon waking up. We wash our hands after using the bathroom. So this very important sunnah of our beloved Prophet sallallahu alaihi wasallam of washing of our hands is already, Muslims are already practicing this if they are mindful of their salat. Also, there is a very beautiful prophetic dua for a person who sneezes. Now we know that by sneezing and coughing, the droplets are airborne and you can infect the person who comes in your contact. So when a person sneezes, there is a very beautiful dua. You say unto him, Yarhamukallah. You say to him, may Allah have mercy upon you. That if you are to be infected, may Allah protect you. So this is a very beautiful advice by our beloved Prophet sallallahu alaihi wasallam. So, and taking necessary measures, there is a very gross misunderstanding about our so-called religious people, that taking necessary measures does not contradict, does not negate the very important principle of tawakkul. Tawakkul means total reliance in the power of Allah, that Allah has the power to do everything. So when we are taking necessary measures, we are not negating the concept of tawakkul. As the famous hadith we all heard, that a Bedouin Sahabi came to Prophet Muhammad sallallahu alaihi wasallam and asked, Ya Rasulullah, O Prophet of Allah, should I tie my camel and then trust in Allah, or should I let my camel loose and then put my trust in Allah? Now this example, we might not understand the example of a camel, but if in this day and age, It would be more appropriate to say, if someone would say to us that lock your car and then entrust it to Allah. Now, if you were to go and park your car in a parking lot or your driveway and you left all your windows open, you did not bother to lock your car, you left your wallet and your iPhone, your smartphone and your belongings, valuable belongings inside your car, and you just left it. And if somebody says to you, what are you doing? Are you not locking your car? You are saying, oh, Allah has my back. I am covered because I have tawakkul. No, my brothers and sisters, this is a very wrong understanding of tawakkul. If something happens to his car, if his iPhone is stolen, if his valuable is stolen, if his car is vandalized, no one is to be blamed except for himself, because he did not do what was in his capacity. Tawakkul means we have to take every precautionary measure, what is in our capacity, what we are able to do, and then trust in Allah subhanahu wa ta'ala. Allah subhanahu wa ta'ala then will take care of ourselves, our loved ones, and our valuable assets. And again, Islam teaches us before the disease takes place, Allah subhanahu wa ta'ala tells us, Rasulullah sallallahu alaihi wasallam instruct us how to take precautionary measures. And even after the virus has spread, the disease has spread totally in any land, what we should do. We have a very beautiful example in the Islamic history when Khalifa Umar, the second Khalifa of Islam, Khalifa Umar radiyallahu ta'ala anhu, was traveling with a group of Sahaba to Syria. And then en route, he camped en route to Syria just before entering the city. And he heard the news that the plague has spread in Sham in Syria. So then he took consultation from his fellow travelers. So some of the Sahabas were with the opinion that we should proceed and we should continue our journey and we should enter Sham, because if something is to happen, that's our fate. And we accepted. But there was few other Sahabas who said, no, we should return back to Medina. And a very famous Sahabi, Abdul Rahman ibn Auf, he had heard this narration from our beloved Prophet sallallahu alaihi wasallam, and he said, if a people of any land are inflicted with disease, or ta'un, or a plague, then the people who are outside should remain outside, do not enter into the city. And people who are already in the city should not exit the city. From here, we learn the very beautiful principle of quarantine and self-isolation. So there is a very great lesson for us. We people, when we come to the masjid, we have to be very, very responsible and very considerate. If we have any signs of symptoms, we have to self-isolate. We have to ensure that we do not come out of our homes. And we have to be very responsible for the fellow Muslims who are performing salat with us in our masjid. And the example is there for us. If you are going to read namaz, you will be rewarded for congregational salat within your own homes. Allah subhanahu wa ta'ala is Kareem. Allah is most merciful. Allah subhanahu wa ta'ala will give you the full reward. So therefore, we have to ensure that we self-isolate and we act responsibly and we inform all the people who we have come in contact with. Now, Allah subhanahu wa ta'ala says, a lot of people ask this question, that there's so many information and it's mind-boggling with all this information circulating on the internet and we are receiving on our phones. So we have to remember, in the midst of pandemic, there is a lot of panic and chaos, and especially when fake news and fabricated stories and conspiracy theories are circulating. We have to make sure that we are not listening to all these stories, fabricated stories, with open ears. The Quranic injunction for us is Surah Al-Hujurat, Ya ayyuhalladhina amanu in ja'akum fasiqun binaba'in fatabayyanu an tusibu qawman bijahala. That if you receive a news from unreliable source, please do not forward it. We must ensure that we verify it, that how credible and reliable it is. Is it from a reliable source or credible source? And is it validated? Only then we should forward it. Otherwise, we should not, because we will then cause more harm than good. We will cause more panic and more chaos. And it is it can be potentially very harmful to the people who are receiving on the other end. We have to ensure that we seek protection from the prophetic du'as. Rasulullah sallallahu alaihi wasallam, our beloved Prophet sallallahu alaihi wasallam, has said that if we recite the three quls, the Qul huwallahu ahad, Suratul Ikhlas, Suratul Falaq, Suratul Nas, 3 times after Fajr Salat and 3 times after Maghrib Salat, yakfiq, it will be sufficient for your protection and for protection of your loved ones. It is very important. Now, almost 99.9%, all the believers and all the Muslim men and women can very easily incorporate this surah, these surahs in our daily routine. 3 times after Fajr and 3 times after Maghrib, and the most it takes is 2 minutes. The 2 minutes is a great source of protection for us, for our loved ones, and out of 24 hours, what is 2 minutes? May Allah subhanahu wa ta'ala accept our efforts, and may Allah subhanahu wa ta'ala keep us all well protected and safeguarded, and may Allah subhanahu wa ta'ala make sure that the new year, the 2021, is very prosperous for us and very prosperous. And also may Allah subhanahu wa ta'ala with his infinite mercy defeat the virus, and we start living normal as possible like we used to live in 2019. Jazakumullah ahsan al-jaza fid darain.
Jazakallah Moulana. Thanks for your time. We'll move on. We've got Dr. Munir. Jazakallah again for being with us tonight. So Dr. Munir's he's made a presentation. He's got some diagrams and some written information. Dr. Munir, are you ready for your slides? Are you able to screen share? Perfect. Jazakallah.
Okay, well, thank you very much, Mubeen, for inviting me for this talk. It's pretty simple. What I wanted is next 10-15 minutes is to take some of the trust deficit that has been last couple of months, and also bring some realities into that. And then my purpose would be to give you scientific evidences, and then I leave you to decide what you want to take from that. I just like to highlight is that I am involved with the COVID-19 and SARS-2 research from the beginning. By the time when this disease didn't even have a name, we didn't know what was the causative agent. At that point, close to the New Year Eve, we called it mysterious disease. So I've been covering this one right from that point over the media. Over 500, 600 times I came over the media and discussed about different aspects. But not only that, over the media, I am actually working with this virus. I have seen this virus myself, and I am actually working in the lab. We have developed COVID-19 vaccine, which is one of the few vaccines coming from the UK, which is already completed the preclinical studies. And earlier next year, we're going to go to the phase 1 and phase 2 trial in Egypt. And that is recognized by the World Health Organization because our approach is intranasal vaccine. And I also sit on to the WHO expert panel on animal models and vaccine. And also just would like to give you a flavor what kind of research I do is that we have developed an artificial intelligence assisted diagnostic assay, which I'm very pleased to share that last month we got the MHRA approval. That means that it can be legitimately used not only in the UK, but around the world. And we have a spin out that is really working on to this. So just to give you an idea what kind of research we do, and just to put into the perspective that all the viruses that are causing infection into the human throughout the world can be accommodated onto a tablespoon, right? But we work with this virus because I have only few of the labs that are called. So we work with, maybe other people can just turn off their mics. That would help. Right. So just to get into the business straight, I have a very simple agenda, and the agenda is to tell you why we need COVID-19 vaccine. First 5 minutes, and then I will take you to some of the myths that you already probably have in mind. We will cover some of them in our question answer session, but at the same time, I'm just going to pick some of those and will provide some factual responses in the next 5 minutes. The first thing I would like to emphasize onto the fact that, for example, if we take a look onto the infectious diseases, every year in the last century, in 20th century, we have a massive burden of infectious diseases. For example, for measles, which is very common infection, everybody know in one way or other, we have had like 500,000 of cases in the last century. Then we have pertussis, mumps, rubella, smallpox, diphtheria, polio, very few out of a lot of other examples. Large number of cases were reported at that time. For example, if you speak to anybody from 80s, they know someone in their family, in the relative, would have had a polio, as is one of my cousin who is 50 years old, has had a polio, a paralytic polio, so can't really walk. But then we introduced vaccines. And what happened is that just this is the data for 2019. You can see from 500,000 to 1,200 cases. And then similar is for all other infection. And that is a massive reduction. We were talking about more than 90% reduction in the diseases. And that would have not happened if we would have not used the vaccine. So that is all happened because of the vaccine. The second thing I would like to highlight here is that flu vaccine is something that we are probably more aware of and more familiar with. So flu vaccine has been one of the most, I would say, worst vaccine into the virology history. It's not just because of the lack of technology, lack of understanding. It's just the virus. It is like that. It's a segmented virus. It has 8 different components. If 8 components of one virus intermingle with the 8 components of another virus, it come up with a new virus that have another 8 components. So this means that every year we have to revise the vaccine. Therefore, the vaccine efficacy has been relatively low. So what we're talking about, the flu vaccine is around 60 to 70% the most is the efficacy that we could count on. But yet we are using the flu jab in the UK at a massive scale because it does help to protect against the infection itself. But when we compare the flu jab with the COVID-19, you will be making assessment yourself that we are talking about 90% effective vaccine compared to, say, 19 to 60, 65% effective vaccine with the flu. So I don't really see the reason why not to have the COVID-19 vaccine. One more thing I would like to highlight, you can make, of course, the COVID-19 mortality comparison with any other infectious diseases, but one of the diseases that has a very devastating impact into the humanity, not only in the UK, but also around the globe, is HIV, which then can lead to AIDS. If we look on the number of people who have died in the UK, 63,000 people by yesterday, I think 400 something today, are in all of them, just in 1 year caused by COVID-19, the deaths are more than last 20 years death caused by HIV and AIDS. So that is massive. That's what I want to put the figure on. So it's not just a matter of an infection that can have a recovery rate 99%. It has a massive impact onto the mortality. One more thing I would like to highlight, that many people ask the question that, okay, well, if one person is infected, what does that make any difference into the community? Let me put you one scenario that is a real scenario in Maine in the US. What happened was there was a wedding ceremony where 55 people attended, only one person was infected. What happened is that one person, when came back, it infected another 177 people within family, relatives, contacts, and so on. And out of those 177, 7 people died. And these 7 people were not the one who actually participated in that wedding ceremony. So that is really when we talk about infectious diseases, when we talk about diseases that are very easy to transmit, like respiratory infections, like COVID-19. So it's not just about you, it's about if you get the infection, you can pass on to someone and who can then ultimately die because of the age, because of vulnerability or other underlying condition. So we have to think a little bit beyond personalized, interest. We have to think about the community, and that is really a big example how do we need to take care of the community. And one of the option is to have a vaccine. The last point I want to highlight onto why vaccine is so important. For me, of course, for every family who has lost their loved one is really a tragedy. But for me, equally important is the livelihood, not just the life. So, for example, thinking about this is the figure from the US, but the figures in the UK is also not very different. For example, in leisure and hospitality, 40% unemployment rate. I mean, in the UK, we have had a very good success by the furlough scheme that has sort of covered to some extent, but that is applicable in every sector and every walk of life we can think of. So when somebody loses the job, what it would have impact onto the family and onto the living, that is one of the concerns. There has been a survey where people have been asked, like, if you lose the job because of COVID-19, how long you can survive? 35% of the respondents said that within 1 month, they will lose everything. What the saving they have, they won't live more than 1 month. And similarly is the case for 1 and 3. And then 15% said that within 6 months, they will be back on street. And then there are only 23% that say 7 months plus they will be able to live. So that is really the impact we are talking about. Lastly, people think that, okay, if we will have a natural course of infection into the population, we might establish herd immunity. But not really that case. Just let me put into one perspective. The perspective is that in 1 year of the infection of COVID-19 into the human population, we have around 20% people, those are now exposed. So that means 80% people are still susceptible. But this also means that if we carry on with the herd immunity path, we need another 2 to 3 years to have enough immunity into the population. And you can imagine 63,000 people died in the UK in 1 year, that you can multiply with a few years as we move along. But how we can mitigate this problem? So we have to achieve 60% of immunity, meaning 60 people out of 100 have to have some level of immunity against this infection. Then we can stop the transmission. Then we can establish a basis for curtailing this pandemic. So if we would have the vaccine starting from here, 20% of the immunity currently existing in the population, we can increase the immunization through vaccination, which will establish immunity, and that would help to reduce the infection at the lower level. So infection is in here, and here is the vaccination. So what will happen is that if we carry on to the momentum as per calculation, we are having access to the vaccine, by end of next year, we will have the immunity that would be at the level where we can say now the transmission from one person to another person can be stopped. And that is what we have to work for the whole year to achieve this point. But if we don't do that, coming through this way, it's really going to take another 2-3 years. So that is the last reason I want to say why vaccine is more important. Just to put into sort of perspective what vaccine we have now, Pfizer and BioNTech is the vaccine that everybody of us now that is reaching to the UK. Some doses have already been administered, and we are preparing in different sectors to get it along. It is based on 2 doses, has to be given 3 weeks apart. And then after the second dose, it would take another 1 week before you establish the protective immunity. At that point, you will be safe from getting the severe form of the infection. The people who will be immunized, they will be less likely to go to hospitalized and then sadly die. So that is really advantage. But as the data stands, we don't know whether the person would still be protected from getting infection or in transmitting the infection. So if this later 2 questions will not be addressed, that means that people who are vaccinated still have to self-isolate, still have to go to quarantine, but this will protect people from dying. So it's a more life-saving vaccine than saving from the infection. So this is just to give you an idea of what this vaccine would offer. So this is a start of a big project. I mean, we haven't practiced this massive vaccination in a very short time in the living history. We've been doing for flu, we have tried for the swine flu, but it wasn't at that scale. what we are referring to. But the important point here is that it's not just about few people vaccinated and getting all the benefit of the vaccine into the community. It will take time. We have to vaccinate at least 60 to 75% people in the community to establish the herd immunity such that we can break the transmission of the virus from one person to another person. And that required 13 billion doses. And all the vaccines, those are in the front runner, cannot provide all these doses. So we are talking about still following all those restrictions that are being put in place to be followed for some time before we really can take some relaxation. With this said, I quickly want to go through a few of the points that I have collected. These are probably the question in everybody's mind, so I would like to go through these, and if there would be anything left or there would be anything not clear, we will be happy to cover during our question on session. So vaccine hesitancy is really a big problem. And don't take me negative. My experience is that vaccine hesitancy is even more problematic in the immigrant community. One of the survey, very reliable survey that has been conducted in London indicated that 40% Asian and Black ethnic minority people agreed to take the vaccine compared to 70% white British. So that is really something that we have to work very closely with the community to really make sure that they do understand what is in there and then let them to make the choice. The first misconception is really that, okay, if we take the vaccine, it might integrate into our genome. And because it is integrated into the genome, people can access the biometric information. People can track them. People can get the information which they otherwise don't get. Let me clarify in a very simple term. The surveillance, the human surveillance, can be done by many other easy ways. By mobile phones, we are all being tracked all the time anyways. Going through doing the same thing through the vaccination is a very expensive approach, and nobody can do it. The reason why nobody can do it is that the vaccines, those are being used in our in the country, for example, Pfizer, BioNTech, and Moderna. That's what I am referring to, including AstraZeneca a little bit. So all my concern is about these three vaccines, because each vaccine has its own approach, own technology, so it would be different for each of the vaccine. So the mRNA vaccine cannot go into our DNA because it remains into the cytoplasm in our cell. So if you remember for your biology classes, we have a cell, it has a nucleus, and then it has a cytoplasm. The DNA, our DNA, is in the nucleus. So the mRNA will only be in the cytoplasm. So if it doesn't go into the nucleus, it can't integrate over there. So that is as simple as that. And that is applicable for all three vaccines I'm referring to. Pfizer, Moderna, and AstraZeneca vaccine is also DNA, but it doesn't go into the nucleus. It only remains into the cytoplasm. So it's a false claim. It cannot be done. The second question people are very much concerned about is that vaccines are made into cells that are acquired from the aborted fetus or lung of aborted fetus or so. Let me make it very clear. Virus vaccines have to be made onto the cells of any origin, because the viruses need cell as a media to grow, to make more copies, to make more viruses of their own. Bacteria don't need that. Bacteria can make their own multiplication. They can make 1 to 2, 2 to 4, like a binary fission or so. Viruses have to have the cells to grow more and more. And that is what AstraZeneca is using. But just to clarify, those cells, those were collected from the aborted fetus. Those were in 70s and 80s, and those fetus were not aborted for this reason. Those were aborted for legally, for other reasons, and the cells those were acquired from that, those were processed so much time that the one that we use in the laboratory is not really the original ones. It has lost its originality. That is one point. The second important point is that even though those cells are used to make the vaccine, but when the vaccine is purified, the vaccine doses are made, those cells are removed out of that. So the vaccine dose that go into our arm doesn't have those cells. It's as simple as that. One of the concerns, of course, particularly in the Muslim community, is that there are some substances in the vaccines, those are objectionable for religious reason or for other reason. Certainly, we do understand there are vaccines, for example, the flu vaccine that has a gelatin, which is pork origin, is it's important for the antigen, the virus itself, to maintain its structure, maintain its integrity. So therefore, those are added in for purpose. But that is not applicable for any of these three vaccines, Pfizer, Moderna, or the AstraZeneca. That is very likely going to be used. So it is true in that perspective, but it is no relevance to these three vaccines. There are some substances in that. One of the questions that we got is about that, and I will clarify at that point, but that is no relevance to any of these three vaccines. And I'm going to quickly go through these 3 points as well. That they say vaccines are genetically modified substances. Yes, absolutely. They are, because without modifying the substances, without modifying the virus, we can't make the recombinant vaccines, right? So without modification, we can't make the vaccine. It's either is having it or not having it. So there is no any question in between. However, all the majority of the commodities we use, banana, strawberry, from any of the thing that you can think of, has some element of genetic modification. So we are using that one on to the regular basis anyways. Some people say, oh, well, whether the vaccine would be available for the vegetarian or for halal options. The Pfizer and Moderna vaccines, these are mRNA-based vaccines. These are purely synthetic. Okay, so they have no any source originated from animal or human. So therefore, they are purely halal. They are purely applicable for vegetarian, and that make life in the Muslim community relatively easier, because we didn't have the mRNA-based vaccine before, so there was always a question around that. So good news there. Some people say that, okay, at one end, Pfizer and Moderna and other pharmaceutical, they claim that the vaccines are very safe and effective. So you go ahead, use it. But at the same time, they do apply for the indemnity in the government, right? But let me clarify one thing. Vaccines, of course, appear to be very fancy business, but it's a very expensive business. For my vaccine, and the one that we are developing at the Lancaster University, to go into the phase 1 and phase 2 trial, I need 15 million pounds. Right? So it's very expensive, because all of the GMP, all of the manufacturing, customization, people for the recruitment, all the associated factors contribute that much. For example, AstraZeneca, it was given 60 million pounds were given by the government from your and my taxpayer money to develop this vaccine. So it's a very expensive process. What happened is that if pharmaceutical go to a country where, for one or other reason, somebody claim for the compensation, pharmaceutical can't afford that, because they already spent a lot of money in developing it, and then the time comes for the profit, they can't get it. They have to go to the government to make sure that if there is any problem associated with that, then the government is responsible. Therefore, every government have its own indemnity policy. UK has it's called Vaccine Payment Act 1979. That means if anybody would have any disability or severe consequences by the vaccine, they will be paid one-off £120,000. But that is not just because of the vaccine. That is just because the government want the pharmaceutical to come and do the business. So the last 2 points are relatively critical. People say that, okay, this time the vaccine have been rushed, so we don't really know if it is, really something to go about or not. Let me clarify one thing. The coronavirus is been in our veins for a long time. The first pandemic we have had was in 2002, 2003, and then the second pandemic came in 2013 with MERS. Based on those coronaviruses, we have learned a lot. We know which gene need to be used for the vaccine. We knew what components are important for protection against the virus. So although we developed the vaccine in 1 year, but basically we have a knowledge of 17 years that was gathered and quickly put into the vaccine relatively easily. And because of the unprecedented need, there was a quite lot of collaboration between the government, between the pharmaceuticals, and of course the people who were taking part into the trials were also available. I mean, when the government make announcement that we need volunteer for the phase 1 and phase 2 trial, now on the list of the UK, there are 340,000 people agreeing to take part in the trial. And I know I've been involved in a trial of another vaccine before the coronavirus. You have to beg people to take part into the trial. So therefore, those trials were done in parallel instead of doing sequentially, allowing to collect the data relatively early. And also the second point is also associated with the safety profile. Just to put into the perspective, the mRNA based vaccine, they are new, certainly. I mean, we haven't had any registered vaccine based on this technology before. But the first mRNA vaccine that was used in human was back in 2013 against rabies virus. And since then, every year, some of the mRNA-based vaccine have been used against cytomegalovirus, influenza virus, and other viruses as well. So we have around 7 to 8 years of safety profile around that. So therefore, we can say for sure there is no short-term safety issues, but there might be long-term issue which we don't really know. And I will, in last two slides, I will touch upon those two things. So the short-term safety profiles is not a problem at all, because everything that you use as a pharmaceutical intervention will have some side effects. And we have GPs here, they will testify me that even paracetamol is not free of any side effects. So there are always, the question is that whether those are permanent or short-lived or not. For the vaccines, all the short-term side effects are short-lived, as name indicates. They go within 1 week, all are gone. Right, and then all of the vaccine, they have it. Question mainly concerns come around the long-term effect. First thing, they are very rare, 1 in 1 million, and 1 in 1 million could be anything. You know, the plane flying up on the sky can fall onto your roof. 1 in 1 million possibility can happen. You take the car onto the road, 1 in 1 million accident possibility is there. So that is rare event, and anything, as I said, is a pharmaceutical invention, artificial way to induce the immunity against the virus possibility do exist. And that is what the trial is ongoing. People who have been tested, they will be watched for next 2 years to really demonstrate if there is any long-term side effects or not. The last slide, I want to put everything into the perspective and give you a balanced overview for you to make the choice. What is our daily risk? The daily risk is that we have so far around 71 million infections, around 196,000 are coming every day. And we have 1.6 million deaths. That means 4,400 deaths a day. That means 3 people are dying every minute, right? That is our current daily risk. But what we have in availability, we have a vaccine that is 75% effective. We have vaccine that is tested either in 43,000 volunteers for the Pfizer case or 30,000 in Moderna case. And all those people who were over there, with few exceptions, because it's a life, things happen even without being part of the trial. All those people are doing fine. So we have a very strong 2 months safety profile. I know this is for short term, but for the long term, as I said, is 1 in 1 million, which is extremely rare. So we're putting these two perspectives. You have a daily risk and what is available at the moment. My duty was to provide you scientific evidences, but I leave the choice for you to decide which way you want to go. Thank you very much.
Thank you very much, Dr. Munir. Very useful, very informative. Thank you so much for that. We've got lots of questions for you as well. We will come on to that. You briefly alluded to impacts on livelihood and the economy and so on and so forth. I'd like to ask Dr. Sakthi if you could step in here and talk some more about the societal impacts of the lockdown, not so much the COVID itself, but the lockdown. I'll let you talk. Thank you so much.
Thank you, Mubeen, and it's a pleasure to be with you this evening. And I also wanted to thank Moulana ji for those beautiful verses at the beginning, and how close the religious teachings are very relevant to the current situation in this pandemic. We have come a long way as a society since it all began, and in my role as the Director of Public Health for Lancashire, I've been with it since the first 2 cases were notified to me. Now, just in Preston, we are just short of 8,000 cases. So we have been with it since, well, I've been dealing with it since it all began, and seen not just the impact it has had on people's health and our hospitals, but also across our society. The very closest thing that we hold dearest and nearest, like hugging people, shaking hands, being with our relatives when they are ill, even taking care of the children when somebody is ill, has all been compromised during this horrible few months that we've been in. And not just that, because there is no way to prevent getting the virus and being affected by it until we have a full vaccination program, like Dr. Munir was explaining. The only thing that was in our hands, and that still is very relevant, is washing hands, wearing a face covering, and maintaining the distance between us, which Moulana ji beautifully explained at the beginning, has been the key tool, the key weapon for us against this invisible virus, which also meant a large part of the economy was affected, whether that is hospitality industry, non-essential shops. And I just wanted to pay tribute to all the key frontline workers in all these sectors, not just in health and care sector, for their bravery and contribution. And in doing so, particularly people from Black, Asian, minority ethnic communities have been more affected as well. This therefore has had an effect on multiple facets in the economy as well as health. Now, there is one thing that's very, very clear. We save lives, we also save livelihoods during this pandemic. But when we just focus on the economy, which is more important as well, but without having a focus on our health, we can't save lives, and just by saving the economy, which meant there are some hard choices that we as a society made, governments made, and each and every one of us have become very aware during this last few months about what each of us can do. And I'll just name a couple of things which I've been personally watching and observing, but also in my public health role. People have become lonely. People spend more time, yes, within their families, but also because of the wider effects. There are lots of domestic issues. Children's education has been affected, which means that it's not just a health issue, but a wealth issue as well. And the only way to address this is to see health and wealth as the two strands or two sides of the same coin. And there is hope. And I also wanted to highlight that we've gone through the first wave. The second wave has affected us, not so badly, but really badly as the seasons are changing and we are into the second wave. In Preston, particularly, overall, it's a good news. The number of cases are coming down. The number of people coming forward for testing is improved, and we are finding less and less people. But in the last couple of weeks, we are starting to see particularly more older people being affected as well. And that is very, very important as we go into the Christmas season, where we're all going to have more relaxation in the rules, meeting relatives and family members and so on. And we need to be very vigilant in the fact that just because we could meet a lot more relatives during this time doesn't always mean we should. And I would ask everyone to make safe choices, smart choices, continue to have the hand washing, face coverings, and the distance maintained. And just finally, there are three things that are really important now if we are to come out of these restrictions, and in a way that we are coming out of it once for all. The first thing, which we've always done very well in Preston, and I particularly want to thank the Muslim community, because there has, amongst all the anxieties and all the myths and all of that, there has not been, apart from the wider effects it's had on the BAME group, there has not been a major incident that is particularly brought the faith under the spotlight, particularly in terms of faith settings and places of worship. So I really wanted to thank you. But the first thing is maintaining the hands washing, face masks, and the distance. The second thing is testing. There are lots of concerns because 1/3 of all the cases, the scientific research is telling us, which we didn't know right at the beginning. 1/3 of all the cases could be asymptomatic or people without symptoms. So we now are rolling out testing, which you can get the results on the spot or within the hour across our communities. And I'll be working with friends in this group to get the tests to people so we can find where the virus is hiding and we can support people. That's the second thing. And the third thing is vaccination itself. Fantastic presentation by Dr. Munir. Lots of questions would have been already answered, but I'm sure there'll be other session as well. These three things put together, if you do it really, really well, and particularly maintain vigilance during the Christmas period, then I'm very, very confident and hopeful that we will see the back of this pandemic. And then we will go back to, or we will resume life as we would want it without restrictions. And the role of the faith sector in providing that hope, providing that service is so great to see. And I'm ever so grateful for everything that the Preston COVID response group has also done in the last few months. So with that, I'll stop there, Mubeen. Happy to take questions, and I know you've sent me some.
Thank you so much, Dr. Sakthi. Very enlightening. Thank you so much. Yep, we've got lots of questions. A lot of them have been answered. Thank you very much, Sakthi. Thank you very much, Dr. Munir. You've actually made my job very, very easy. Let's go to the questions. First question is for Dr. Dasu, GP on the ground, member of the community. Yeah, take it away. Moulana alluded to misinformation and disinformation earlier, and some of these theories and videos are very convincing when they've got titles and labels of doctors underneath. Go on, I'll let you talk, Dr. Dasu. You muted?
Yeah. Thanks very much, Mubeen, and thanks very much, Dr. Munir and Sakthi, for your presentation. So the question is, some conspiracy theorists are doctors. Which doctors do we listen to? What a top question that is. How do we answer it? But what I will say is that there is a difference of opinion that exists in all walks of life, every single field, and in the medical field is no different. I wouldn't actually use the word conspiracy because just because a colleague, a scientist or a doctor has a different opinion and they have a right to voice their opinion in their own manner, doesn't make them conspiracy theorists as such. It just means that they've actually got a version of the events and a judgment that is not in keeping with the generalist opinion. And the question is, which doctors do we listen to? I think Moulana alluded to begin with at the beginning, and what I will say is that we need to use our common sense and our logic. And that's what Islam teaches us as well. And I think the point is that we need to go to the trusted sources and that are regulated, that have clinical structures and governments, clinical governance in places. And we need to go to places that have evidence-based advice and not just personal anecdotal opinions. I think in the first instance, patients and where their problem relates to their personal issue and personal medical problem, their first port of call should be to their general practitioner. At the moment, it is important to add and mention that the GPs are working in a new normal way where I think some patients are hesitant to come to general practitioners as well. So their calls are triaged. We maintain social distancing and treat patients remotely where possible. But the patients should also be reassured that when they are called in to go to GP surgeries and hospitals, all possible mitigating risk factors are addressed, and it is safe for them to visit hospitals and GP surgeries where possible, because obviously the incidence of cancer detection, heart attacks, and other medical problems have gone down. That's probably because patients are taking risks by not getting the appropriate medical advice and medical help, probably because they are staying home. So I would say that they should, first of all, the first port of call would be to contact their general practitioner, and they should seek advice for general issues from trusted sources, for example, the Public Health Department, from the government, from the CCGs, from the CQC and the local council, as opposed to non-regulated, biased opinions from individuals. I hope that answers the question.
Answers it perfectly. Thank you very much. You know, I always say to people, you've trusted your doctor all your life. You know, you've taken the medicines they've said, you've amputated your limbs because the doctor said. Why have we all of a sudden, you know, changed strategy just because faceless, nameless people on the internet are advising others otherwise? Very, very well done. Thank you very much. Next question. I suppose Dr. Munir has answered this in great depth. It's not been rushed over the period of the year. We won't go back into this one. Is that okay, Dr. Munir? Anything additional to add to this?
No, I think we have covered it pretty sufficiently.
Thank you very much. Known side effects of the vaccine, again, Dr. Munir, very, very detailed. You've made my job very easy. It was the main ones was fatigue, which is extreme tiredness and headache. I will add, these side effects are good in the sense that it means that your immune system is mounting a response to the vaccine. So if anything, it means it's working. So it's a nice side effect, think of it that way, but that's been cleared. Long-term side effects. Go on, Dr. Munir, I'll let you mention a few statements on this. I know you've already talked about this.
Yeah, to be honest, nobody can answer this question, how many or if any we would have the long-term effect, but that is what being watched very carefully. My experience states that there wouldn't be any. And if there would be any, that would be a very rare case, because each one of us are very different individuals. Our genetic makeup is different. Our body behave differently. Like even twins, they do behave differently. So there are a few things that you can predict, and then there are a few things that you can't predict. But if we really weigh the possibility that is something hasn't yet happened, the possibility of happening, and then the advantage it poses, for me, if I would have a choice, I would be first in the queue to get the vaccine.
Fantastic. Thank you very much. Me and you both. Okay. How can you trust Pfizer? They've done X, Y, and Z. They've done horrible things. I'll answer this question. We are absolutely not asking people to take the vaccine on the basis of trust in Big Pharma. I'll tell you why I'm more suited to answer this question. Maybe because I might be more distrustful than anybody else on this panel to Big Pharma. Part of my day job is to review their data, to critique their data, to verify their data, fact check it. There is a whole independent, honest, unbiased, free of interference regulatory process. We've got a fantastic organization in this country called the MHRA, quite possibly the best in the world, free from all bias and all influence. And they don't take the word for the pharmaceutical industries. And by the way, all the medicines and everybody on this call have at some point taken medicines. They have gone through an individual vetting process, a very lengthy, costing billions of pounds to get these medicines through clinical trials. And they've been thoroughly vetted. One extra thing that I will say, I mean, oft times I've been accused of bashing Big Pharma sometimes. I will give credit where credit is due on this occasion. Pfizer have actually made the data from their trials public. I'm not sure if many people on the trial on the call are savvy enough to maneuver around the technical details, but it's a whopping 92-page document, and fair play to them. They've been very transparent, and the MHRA, like I said, doing a fantastic job. Above and beyond that, also, and talking, mentioning quickly about long-term side effects, we have what we call post-marketing surveillance. So we don't release a drug into the market and forget about it, and we keep on injecting everybody. Just to give you an example from last week, a couple of people, I think they were healthcare professionals, they had an allergic reaction to one of the vaccines, and that was because they had previous bee sting allergy. So this is post-marketing surveillance kicking in. So now we're going to alert everybody else in the country and say, if you do have a bee sting allergy, if you do have a peanut allergy, please, we don't want you to take the vaccine yet. So we're not unequivocally telling everybody and their pet dog to go and take the vaccine. We're saying if according to our post-marketing surveillance, you don't fall into the same group as somebody else who's had a side effect, then only then we want you to come and take this vaccine. But to specifically answer the question, no, absolutely not. We're not asking anybody to trust Big Pharma. We're not asking you to trust the government. Trust the process. There's an independent, honest, unbiased regulatory process. I hope that answers that question. Move on. Dr. Munir, one for you. Will the vaccine change my DNA? I think this has been answered, but go on.
Yeah. No, it wouldn't. Particularly speaking about the Pfizer and Moderna vaccine, it has literally no chance to get into the DNA. Simple as that.
Fantastic. Thank you very much. Short and sweet. Does the vaccine contain aborted fetal cells? Once again, no, it doesn't. I'll answer that one for you. You've already covered it again in great detail. Absolutely doesn't. No. Can you take this one, Dr. Munir? I think you've already answered it, but go on, I'll let you if there's any points.
Yeah, I just wanted to add a little bit more on to what I said before, is that a vaccine, certainly vaccine whole process itself is very expensive. And I give you example, for my vaccine, I need 15 million. I finally managed 15 million to take into the phase 1 and phase 2 trial. But it's a very expensive process, and 90% of the vaccine that go into the trial fails. I mean, you are only hearing about the positive news about, Pfizer, Moderna, but probably I can tell you, University of Queensland vaccine is failed. They stopped the process. GSK, Sanofi, they said that they are delaying their process until 2021, end of 2021, just because their vaccine wasn't performing the way they would be. And that is another stamp, I would say, that there is a regulatory process, as Mubeen was mentioning, that if anything doesn't fall into that regulatory process, it's going to be kicked out of the frame. So it's a big it's a big business at the same time, but it's a very risky business. Not every pharmaceutical is having capability to risk that business. So therefore, they need a protection. Therefore, governments come up and then they give the liability and the indemnities, because without that, no pharmaceutical will be making any vaccine, and without pharmaceutical, we can't make vaccine. I mean, I have a technology that I can say that my vaccine is an intranasal vaccine, one of the very unique vaccine. WHO love it, but without pharmaceutical, I can't take it to the market. So they are absolute important pillar in establishing a very safe and advisable pharmaceutical, but it's risky at the same time. So therefore, they need some financial liabilities before they really get into the business.
Fantastic, thank you very much. Question for Dr. Sakthi. This one will be a good one for you. So you've had the vaccine. Are we now free? The person who's had the vaccine.
No, is the short answer. The vaccine protects you. We know that from severe disease, from you catching the severe disease and complications. Still, we are waiting for further research trial results, whether you can actually pass the virus to someone without actually being affected by it. And also until, as Dr. Munir showed, until 60 to 70% of the population is vaccinated, the virus still has a chance to jump between people. So that is why the answer to this question is no. But we hope that by end of April, the government's target is to reach a huge proportion of our population. So we're just so close to the end of this. And that's why it is important not to now burst the banks of it. So there was those three things I talked about, the particularly physical distancing restrictions are very, very important, especially as we go into festive period. It's cold, people can meet inside each other's homes, not very ventilated and so on.
Thank you very much. Dr. Munir, please, can you take this one? Do we need is it like flu? We need a vaccination every year? How long does the immunity last? I'll let you talk.
Yeah, well, we don't precisely know for how long the immunity would last with these vaccines. So therefore, that is what we are watching for that time. And as I mentioned before, people who have been vaccinated, they will be watched for the next 2 years. So we will be able to get a very good idea for how long the immunity would last. But based on our experience with other coronaviruses, the immunity lasted at least for 1.5 to 2 years. So now the question is that the immunity is not always the antibody, the one that you can detect and neutralize the virus. It's a complex process. It has T cells, it has a B cell, and it's a priming effect. So altogether, what I can say is that there would be less likely that we need for every year, particularly if the vaccine rolled out relatively quickly and we get a mass vaccination done. We probably peter out the virus very quickly, and that we don't need it. But if the immunity would last only for 1 year, which is not very far to be answered precisely, then we would need every year vaccine like the flu.
Fantastic. Thank you very much for that. Let's move on to the next slide. It's becoming a buzzword, nanoparticles. It does sound very scary. It isn't really. Go on, Dr. Munir, I'll let you explain, please.
Yeah, so to answer this question, you got to trust me, because because there are a few terminologies that would take ages to explain. So I will try to put into a simple term as much as I can. So these nanoparticles, they are nothing other than the mixture of several kinds of lipids, right? So there are deionized lipids, there are PEGs, polyethylene glycol, and then there are cholesterol. All these together make a mesh that can stabilize and protect the mRNA that is lying in the middle. And also, secondly, it take into the particular place within the cell where the mRNA is start making multiple copies of the protein. And that protein, which is a spike protein, will then be taken up by our immune system and train it. So these lipid nanoparticles look like a fancy stuff, but this is nothing other than the different combination of lipid to stabilize the RNA.
Absolutely. Sorry, go on, carry on.
Establish the safety. Yeah. So the next part of the question is that whether it is safe enough to be used. All the lipids that would be part of the lipid nanoparticles, they are the same that our body already have it. And those lipids are not beyond the limit that our body can tolerate. So if somebody is getting 1 dose of Pfizer vaccine, the lipid that would be going in is not beyond our level of tolerance. So those have already been tested, quantified, very well validated. So even if it is something that in inverted commas, some have objection, but that quantity is too little for our body, so it wouldn't have any harmful effect. But it rather would have advantage to take the mRNA and stabilize it and present it in a way that our body can make the immunity against that mRNA.
Fantastic, thank you very much. I'll also add as well that it's not a new technology. I remember studying it 10 years ago, and it's been incorporated into many pharmaceuticals,
Absolutely.
some of which are already being taken by some of the people on this call. So don't worry about nanoparticles. It sounds worse than it is. Over to you, Dr. Munir, again. Can you talk about women, pregnant women, and fertility?
Yeah. So that is certainly some of the things that we don't know, whether the pregnant woman should take the vaccine or not. And that is not because of the risk of the vaccine to the pregnant woman. That is only purely for one reason, and that the pregnant women were not included in phase 3 trial, which is the last stage trial. So therefore, we are not very certain whether the vaccine would perform in pregnant women in the same way as non-pregnant women or in healthy people or other. So therefore, just to being out of cautiousness, because pregnant women are on a different scale of physiology, so we don't really want to burden them. But that is the reason that we are cautious not to use the vaccine in pregnant women. And same is the case with the children as well, because in the children were like less than 18-year-old were not included in the trial. So we don't really know how the vaccine would behave. Therefore, those are excluded from the possibility. But the trials are being conducted where the adolescent, children, and also the pregnant women are included to look for the safety. So until that data doesn't become available, probably it wouldn't be recommended.
Perfect, thank you very much. Dr. Sakthi, can you take this one? When do you think it will be that children will be vaccinated?
I think that's a follow-on answer from Dr. Munir. So until we know that it is, some more data is there, and also children, thankfully, aren't the group that are actually having severe disease when they get infected as well. So the children would be considered in the priority group as a latter groups, not in the first few groups.
Absolutely, yes, thank you. Yeah, I mean, the primary objective is to prevent severe disease. Any long-term immunity is a bonus at this stage. So yeah, thank you very much. I'll let you read that, Dr. Munir. You're better at reading.
Yeah. The first question. Interestingly, I don't know who asked this question. I would really want to meet that person, because this is called epigenetics. So genetic is encoded, A, T, G, C that make the protein, and protein does the job that we do every day. And then there are other changes within the DNA that called epigenetic. And M6A is one of that genes. It's basically specifically called methylation of adenosine 6 at position carbon number 6. And one of my PhD students funded by the British Council is precisely working on to M6A and its role into the stabilization and destabilization of the DNA. So that is the background. But particularly speaking about the mRNA vaccine, So if you take the mRNA and make these changes, M6A, into the mRNA, it will make the RNA more stable, right? So more stability of the RNA means more spike protein will be formed and our immune system will be more stronger. So M6A is critical to make, so this is chemical modification that is done in many of the mRNA to make it more protein out of the same copy. So it's like, you have a copy, you put on the printer and more are you just taking out of that. But if you have a password protected, then it would be only very limited. So this M6A make it password free, more and more copies will be made. But it does not destabilize the DNA because M6A is only in the RNA, not in the DNA. So it is a misconception.
Perfect. Thank you very much. Second part of the question.
It has also because that OR loop. Yeah. So OR loop, actually, many people are asking this question. So let me take a moment and explain this. OR loop is that there is a hybrid between RNA, which is a ribonucleic acid, and the DNA, which is deoxyribonucleic acid. So it is certainly possibility that OR loop will be formed in the mRNA, but that is a very theoretical possibility. So when we design the construct, the mRNA for the vaccine, well, just to put into the context that I know this one because I established mRNA-based vaccine for influenza virus. And we use it animal for the trial. So I know precisely how these mRNA made. So when we make the RNA, there are software, there are different tools that can predict whether this mRNA will make this R loop or not. So we only pick the RNA that does not make this R loop, because if it would be destabilizing for RNA itself. So therefore, if the R loop is formed, it destabilizes the RNA, and then RNA will not make the immunity. But we know that it makes the immunity, Pfizer vaccine, and it does protect 95% people. So that R loop is not there. It's a complete misconception because with the R loop, it would not have been possible to have the stabilized RNA.
Fantastic. Thank you so much for that. Any interactions with medicines? I suppose I can answer that question. Not that we're aware of. What do we need to know about medicines? If you're on a medicine, if you're on blood thinners, warfarin, for example, if you're not on this medicine, you don't need to worry about it. Just take a yellow book with you when you go to get your vaccine, liaise with your anticoagulant nurse. If you're on adrenaline auto-injector, EpiPen, Jextin injection, what else can it be called, Dr. Dasu? Any other names for it?
EpiPen, like you said.
Yep. So if you're
EpiPen
on
is the main one to be prescribed usually.
So if you do have one of them, so these are usually for people with severe allergies, whether it's to nut or food or bee stings or any sort of severe allergy, then you'll be prescribed one of these pens. And in that case, we don't want you to come forward for your vaccine currently. And if you are invited by accident, just let your healthcare professional know, but you probably won't be invited. So as it stands, that's the only cohort of people. Yeah, thank you. Dr. Munir, can you take this one?
Yeah, so the vaccine is up to 95% effective when our immune system is 99%. So why do we healthy people need to get vaccinated? Well, it's not really that simple to say that. First is that, well, 99% people would probably recover from the infection, but then they could pass on the infection to the people who can otherwise not be likely to be recovered. And so therefore, it's better to protect at the first place. And secondly, we don't know what are the long-term impact of the infection, of the COVID-19 infection for even healthy people. And secondly, not everybody's immune system is strong enough to have protection against every pathogen and every infection. So you can't compare yourself with a neighbor. You can't compare, with the twins even. So everybody is different, everybody's immune system. And there are sometimes obvious vulnerabilities. What are the likelihood of getting severe infection, but in other cases, you don't know. I mean, to be honest, I can tell you, I came to know that I have allergic asthma for a really long time, after a long time. So I didn't know that. So there are a few things that you don't know. So therefore, the vaccine efficacy is 95% is better than 99% by the virus itself, for the reason that when somebody gets infected with the virus, the kind of immunity is not the same as you would have with the vaccine. So the immunity built by the vaccine is more profound, more strong. So therefore, the immunity would probably last longer and would be more protected than through the natural course of infection.
Perfect. Thank you so much. So if someone had previously had COVID, do they still need to get vaccinated? Dr. Sakthi, can you take this one, please?
Yes, we are asking people who have had COVID to still come forward to get the vaccines, because we don't know how much the immunity has developed in their own individual situation, and also we know that one can get COVID again, and it can happen. So to avoid that, we do recommend people to come forward for vaccination. In terms of if they currently have COVID, I would recommend if people have some mild fever, but if they currently have COVID, it is a good idea to wait till they recover fully and then come forward. But then if you have doubts, the practitioner, the clinical assessment, they will actually help you out to make that decision as well. So at the moment, that's the advice we're giving. And like we started, even after a couple of days of starting the vaccine, some new information came out, like the people on EpiPen. So that the information continues to change as well. So I recommend you looking at the latest information before going for the vaccine.
Thank you very much. What do we have here? Dr. Munir, I think this is one for you.
This is going to improve my reading. Yeah, so yeah, very, very important question. I really appreciate somebody who asked, whoever has asked this question. So the syncytin-1 sequence is, of course, relatively closer to one part in the spike protein, but it is not exactly the same sequence. So this means that if there is an antibody responses induced against syncytin-1, will not neutralize anything related to that in the spike protein, right? And therefore, it does not pose any impact onto the placenta, onto infertility, or on anything related to the human, particularly in the women. So therefore, it is a complete misconception. Basically, this was proposed by one of the German guy who thought that this is a serious issue. He proposed to the European Medicine Agency, but later it was completely debunked. So this is something that is completely out of question. So you don't need to really think about it even.
Perfect. Thank you very much. And you reminded me to thank the audience, actually. It wouldn't be possible without their questions. Very thought stimulating. We were actually sat with a layperson and we were collating the questions, and as healthcare professionals and as people of science, these questions are really easy for us, but these are very topical questions. So thank you very much to the audience for sending all of these questions, and thank you. One more for you, Dr. Munir. Any concerns about PEG?
Yeah. So as I said, in the nanoparticle that are making some part of the mRNA-based vaccine, there is PEG. There is no doubt on that. But we don't really know whether it is, what is the quantity in there. But as I said before, any quantity of the exogenous material that is put into any pharmaceutical that are first tested, whether it is a toxic, non-toxic, or is really tolerate threshold. So PG is there, but the immunity established against PEG is not really something that need to be worried for the allergic reaction or interfering with the efficacy of the vaccine. First, as I said, it's a very small quantity. And I don't really think that 70% of the people will develop against, because, for example, out of the 40,000 people, those have been tested for the vaccine trial, there wasn't anything like that. So if this would be the real case, then at least, quite a good few thousand people would have this problem, but that is not really the case. So there isn't any concern associated with it. But once again, I would like to emphasize, PG is part of the nanoparticle, but its quantity is too tiny that is within our threshold level, so it's not going to harm anything related to the vaccine immunity or against the antibodies against PEGs.
And I will add as well, again, PEG is something that's been in a lot of pharmaceuticals that we've been taking for decades. So the chances you've had PEG to some degree already in one of your medicines. And one more point to just flesh that out as well, if you don't mind, Dr. Munir. All of these ingredients, so the nanoparticles, the PEG, everything has already gone inside of the vaccine that's been injected, 100,000 doses into all the participants who've taken part in the clinical trial. So all of these components and bits and pieces of the vaccine are being assessed as we go along, and with more and more post-marketing surveillance. So, I mean, I always say 100,000 people in the clinical trial or 100,000 doses is peanuts. The NHS aims to vaccinate 1 million people every week. So that amount of data it's a huge confidence booster for everybody. It's we're gonna get a lot of safety data as we go along.
Absolutely.
Let's keep moving. Dr. Sakthi, can you take this one? Do you think there'll be any mandate on it? I mean, we're not legal advisors, we're not legislators.
Well, it is very unlikely, but what is causing that is that the fact that taking the vaccine will protect you from serious infection, serious disease, but we still don't know whether you can still pass it on to others. Clearly, situations like flights and enclosed spaces are more amenable for the virus to transmit. But if you are, if now we have the tests available before travel and after travel and so on, but as such, with regards to vaccine, the policy is not, at the moment, it's not like we won't be penalized for not taking the vaccine, but this is the one to continue to monitor in terms of if we know more information on people may be protected from the virus themselves, but may pass it on to others, then other things might become more mandatory, like testing. For vaccines as such, from my experience, is unlikely to be, because there are other diseases that we have vaccines for, and that hasn't been the case.
Yeah. And from my perspective, Sakthi, like I've been for Hajj, and you're asked to take a yellow fever vaccine, for example. So I mean, I've got to take that up with the government of the country that I visit. A friend of mine didn't give an MMR vaccine to his children, but when he wanted to go on holiday to somewhere in Asia, that country needed him to have a vaccination. So really, it's
travel advice. Yeah, sorry, Mubeen, just one more point I didn't mention there. Travel advice. It becomes more important if you're going into countries where the virus may be endemic, and we don't quite know that yet because it's still in the middle of a pandemic. So it may change over the period of time as well. But you're quite right. I would certainly advise everyone to take the vaccine if you are being offered one, because as Dr. Munir showed, on balance, I know it's for all of us to make decisions ourselves, but when I look at it from a public health perspective, on balance, I think it's important that we all protect ourselves and our beloved NHS and loved ones. So that's how I would respond to that.
Perfect. Thank you so much. We're moving on to like general COVID questions now, less to do with the vaccine. So yeah, could you enlighten us a little bit? It's ventilation. It's really underestimated. Could you give us a talk about ventilation, Dr. Sakthi?
Yes. Enclosed spaces, poorly ventilated spaces, even if we maintain distance, but if it's not ventilated over a period of time, then although the chances may be smaller if people will transmit the virus, it's still there. It's higher than not being ventilated. And that's especially in this weather where we are likely to be closer, less ventilation. It is important. We are asking all the workers not to keep the windows open all the time, but intermittently let fresh air, especially where there is likely of more people in those settings. So that's why that's the case.
Perfect. Thank you very much. Any advice for people who feel cold, Dr. Sakthi?
I think we all know if you're dressed for the weather, you're dressed for anything to be protected against. But it is important. It is important to wrap ourselves warm, and especially in this time where it's not just COVID. We know that in cold weather, other diseases are more prone as well. And thank goodness that we are not seeing that many viral, influenza and flu because of all the precautions we're already taking, like hand washing hands, and covering faces and so on. But it is also important to look at other health conditions. We know that during cold weather, especially if the temperature drops fairly rapidly, it can affect, we have seen in the past, heart disease and so on and so forth. So wrap up warm and keep yourselves windows open now and then, so that we protect ourselves and keep everyone safe.
Fantastic, really good. I was reading an interesting article. One of the reasons why they reckon household transmission is quite high is if you've got a house with 3, 4, 5 people in it who are COVID positive, they've been breathing COVID out into that air, and that house is absolutely, the air is saturated with COVID. So one person enters into the house and boom, they're straight away going to inhale a huge waft of COVID. So again, one of the other reasons why really we don't want people to visit one another's homes. And when we do leave tier 3, hopefully, get your house ventilated if we are visiting. Thank you very much. That's plenty on that topic. This is one for you, Dr. Dasu. You're on the ground and you're all...
Yeah. The thing is that the concept of test and trace is not actually new. The test and trace has existed for many, many years, many moons actually, because in general practice, there are a list of illnesses that we have to notify, and GPs are duty bound, or any other clinicians who actually see some illness like measles, mumps, rubella, for example. They are all notifiable infections. So, for example, if a GP were to come into, diagnose a patient with any of these notifiable illnesses, we would contact Sakthi's team at Public Health, and they would initiate this test and trace. And the purpose of this is to get to the root cause of where the infection initiated from, so to enable us to nip it in the bud, to prevent this wider spread of the actual infection. And without that, the infection can spread very, very rapidly. And therefore, this test and trace has been multiplied multifold for this COVID-19. And I know patients and a lot of the general public is apprehensive about test and trace, but the actual concept is very, very old, and it's used, it has been used very successfully for a very, very long duration. And saying that, I think whilst we're on the topic of vaccinations, the notifiable infections are very rare now. And the reasons they are rare, like smallpox, polio, diphtheria, tetanus, is because of successful vaccination programs. And all these vaccinations did originate from somewhere, in a lab somewhere, and therefore COVID-19 is no different. I think we do have to make a start somewhere, and a vaccine is a very, very important aspect of fighting this infection, such as or the other notifiable infections as well. I think the second question, are there legal implications of declaring restrictions? I don't think there are any legal restrictions as such. I think patients are generally concerned, general public is generally concerned that with the legal implication, what if I declare that I've actually been to somebody's house and I'll get into trouble with this? I don't think the test and trace have a legal powers to inform the public servants or inform the police or the government that this thing has happened. I think the purpose of test and trace is solely for restricting the actual infection and the spread of it, as opposed to kind of grasping on you, for example, as opposed to telling of where you've been and use it as a means to punish you.
If I may add there, you're absolutely right. The test and trace will not pass the details to enforcement agencies. Yeah. However, if somebody complains or if the council or the police finds that, especially in tier 3, there are mass gatherings happening in each of those houses, that's a different issue. It doesn't really get through the NHS test and trace. I just wanted to add that. So please participate and give the information, because as Arif was saying, this is to protect others that might have been exposed, and also to bring the virus under control.
And just to finish on that, I think the thing is the person who's got the virus has already got it. And the purpose of test and trace is to prevent the other healthy population from getting the virus. And as Moulana kind of alluded to at the beginning, that it is our duty to prevent the spread of infection. And the whole point of test and trace is to your loved ones and the community in a wider sense don't get the infection.
Fantastic, thank you very much. Dr. Sakthi, this is one for you. A lot of talk about mass testing.
Yeah, very highly debated, controversial topic often. Basically, if you cut to the chase, we know that there are a lot of people that may be carrying the virus but not showing symptoms. And also, previously, the tests where you have to take a sample, you take to the lab, there is a delay and so on. With the mass testing, I call it smart testing. So it's not like mass and we just do the tests like in other places where you build it and people will come. What we're doing here in Lancashire is we are making use of that facility that's being made available to us to offer the test. It's free and you can get the results within the hour. And it just helps, like building on what Dr. Dasu was saying before, to find people who may have been, harboring the virus and prevent them from spreading it on to others. That's what's happening in this program. We are getting that in Lancashire, in Preston as well. Initially, we are offering it to major employers so they can find individuals so that there's no disruption to them and they can continue training and so on. But very quickly, in the next week and in the next few days, just before Christmas, we're going to scale it up across many parts of Lancashire, and then in the new year it'll be really available fully for across the county. So please, again, if you come to know about it, you don't have to have a booking. It's free. It is from the council and in partnership with the NHS, and I'd welcome your input as well in terms of where we can place these tests and make it available for our communities. So that's the rationale behind it. It's mainly to find people who may be harboring the virus. The accuracy is another one of the tests is not accurate. It's not picking up all the virus and so on. It is quite true. It's not as accurate as PCR tests. But if you found positive with this lateral flow device, it's a very highly specific test. You are highly likely to be positive with the virus, and therefore it helps to find that. But if you're negative, that's where the debate is at the moment, that it's about 50% accurate if you're negative. So that's even very important that if you find negative, doesn't mean that you are free of the virus and therefore you can go and mingle and so on. That's a completely different way of looking at it. But we are working on if we can repeat test people that are negative, and then if they're still found negative, then the accuracy improves. So that's a new policy that will come into effect, and that might change the way we isolate, change the way we open up sectors. So look out for that. All of this means that it's important we go for regular testing if it's available in our communities, and it is happening. So coming week and the week after, you'll hear more about it. So please do engage if you hear about that. It's smart testing.
Fantastic. Thank you so much. This leads me to my next question. So why is it that we do want to test these people even though they've got no symptoms? This is a question from my mum, actually. She says, I don't need to take precautions from her because she doesn't have any symptoms and I don't have any symptoms. Have you got any stats that show how many people have COVID but they've got no symptoms?
Yeah, various studies. So up to 1/3 of, if you take the whole population with COVID, up to 1/3 could not have symptoms. And more importantly, people who don't have symptoms, who are they coming in contact with often? Is those loved ones, is the family members, and that's why we need to take precautions, especially between households. So if you don't live in the same house, that's where it's very, very important. So that's the reason why we do need to be precautious at the moment. So in a few months' time, when the levels of virus goes down, I would be saying, February, March time, seasons improve, the virus levels goes down, then those restrictions may lift. And as we go into the tier 2 and tier 1, it will definitely lift. So a few more weeks is really, really important for us to maintain those precautions.
Thank you very much. Okay, so we're testing more. So we're finding these.
Actually, that's not the case. The testing more, but the percentage of people that are actually turning out to be positive, we have really decreased. It was like 11%, 10%. Now it's somewhere between 4 and 5%. It's still high percent. That's why we are in tier 3. But no, that is actually, it's a good thing to find more cases, because once we find more cases, at least we know where they are and support them. And it definitely will help us preventing the spread.
Thank you so much. So common misconception, people think if they take a COVID test, so they're in 10 days isolation or 14 days isolation, they take a test, it comes back negative. Can they leave isolation?
No, at the moment, the rules are changing from, if you're a contact of someone, you used to remain in isolation for 14 days. From Monday, it's coming down to 10 days. And that's because our understanding of those who may get it as a result of being a contact is improving. And that, therefore, the confidence levels have increased so that the duration has come down to 10 days. There are still some ongoing projects going on to test every contact every day. And that is not quite there yet. So once we know, we're confident about that, we may be in a situation where if you're a contact, you may be given a box of tests and you'll be asked to do every day. And after a certain time, you can go about your normal time, but we're not there yet. So until we're sure about that, we're asking people to isolate for 10 days. Perfect.
And is that because the virus itself will manifest at any of them 10 days?
Yeah, so the normal incubation period is on average 7 days. To be sure, it was 2 incubation periods, which is 14 days after you may have become a contact with someone. So after that time, somebody developing their own self disease is very low. So that's why it was 14 days. Now we have been monitoring all of that, and when people may become symptomatic or get the disease, because of the research and all the data that we've collated, we are now bringing it back from 14 days to 10 days. So that's the reason why it is 10 days or 14 days as it's been. And every disease has got different incubation periods, and that's why the isolation is different.
Fantastic. This is really good. Thank you. Okay, so what's the story between 1 meter and 2 meter? Dr. Dasu, can you maybe...
Yeah, we'll answer that question, but I just need to add to the previous question. So Dr. Sakthi mentioned incubation period. Just for general public, the incubation period is the period it takes from you actually getting the virus and start showing symptoms of the virus. Therefore, you might even have the virus without knowing that you got it. That's why there is a period of 14 days. And also before that, about the vaccination, I'll just quickly add that in Preston, there are 2 main networks. One is the network we belong to, and it's Preston North. And we are using East Medical Centre as our base for vaccination. And the other network are using Jeffrey Street, which is a health centre on Newhall Lane, for their vaccinations. And patients who are worried whether they should be or shouldn't be having vaccines at the moment, they are being contacted by the GP surgery. And if you've been contacted by the surgery itself, then you know that, yes, you are due to have the vaccine. And if you're worried whether you've not been contacted yet, you will be contacted when your turn comes. Fantastic. So I hope that clarifies that. I think this is a very important question. Please can you explain the implication of 2 meters and 1 meter? I think there's no doubt that everybody agrees that transmission of the actual SARS-CoV coronavirus is associated with close and prolonged contact, suggesting that the close contact between person to person directly implicates, and that's how the virus spreads. And therefore, when the government initially, came up with guidance, they have to come up with a system which was standardized. Therefore, they suggested that this 2 meter distance was probably the most safest distance to be with, but not too much to cause a lot of problems as such. And this 2 meter distance was revised in the summer, where some businesses were opening and a 2 meter distance was not viable for them. So the government suggested, yes, maybe you can be 1 meter distance as long as you can have some mitigating factors. So, for example, wearing masks, washing hands, ventilating properly, have certain health and infection control measures in place, infection control audits. And when you've satisfied yourself, then you can. But I think when we talk about medicine, we have to talk about the benefits and the risks. So we have to judge the benefits of reducing to 1 meter against the risks involved of transmission of the virus by coming to 1 meter. I think, for example, for the places of worship and, for example, mosque or other buildings or institutions, if you go down from 2 meter to 1 meter distance, it will only increase the capacity by 25%. And also, we have to be mindful when we address the mitigating factors regarding the population we are representing. And we need to weigh up the likelihood of exposure to the vulnerability of the population concerned. We all know that the virus hits the South Asian population the hardest. The implications of complications are highest in the South Asian population. So when the committee members and certain institutions can satisfy themselves that yes, they have addressed all the mitigating factors, they have satisfied themselves that yes, we understand the risks involved and we have actually taken measures to address those. And I think the most important part here is, for example, places of worship like mosques, for example, if the musallis or their congregation that attends, if they can fit them in with a 2 meter distance without any other measures, then we should stick to 2 meters because the increased capacity is not needed. However, if there is a need where the congregation, the prayer is not big enough and there is an actual need to reduce to 1 meter, and if the committee can satisfy themselves that all the mitigating factors have been addressed and the risk factors have been addressed as well, then yes, then there's no harm in going down to 1 meter, but then we have to address those issues first. Thank you.
Thank you. Any statistics? How much does risk in absolute terms increases? Have we got any figures?
I think.
Sorry, go on if you have.
I think what are they? There are some statistics. For example, with physical distancing, if you're at 1 meter, there's a 12.8% of transmission of the virus. Now, if you go down to 2 meters or more than 1 meter, it automatically reduces to 2.6%. Wearing the face mask, for example, the risk without it is 17%, and risk with wearing a face mask is 3.1%. And eye protection, so for example, visors, glasses for patients who can't wear, people who can't wear face masks, the without protection is 16%, and with protection is 5%. So the data is there that taking mitigating factors and protecting factors do definitely help that. And I think we should take those into strong consideration when we are making those decisions, whether to come down to 1 meter. And I think if, like I said, I'm going to just make that point again, that we should only come down to 1 meter when there is an actual need for that, and only after the mitigating factors and the risks have been addressed. And if that's the case, if that's been done, then there might be a possibility for us to do that.
Fantastic. Go on, Dr. Sakthi, just flesh it out a bit more. What were you saying?
No, just on the scientific evidence, the SAGE, which is the Scientific Advisory Group on Agencies, have advised people on this. And if you just look at the risk of transmission, it increases somewhere between 2 to 10 times if you change from 2 meters to 1 meter. So that's what Dr. Arif was saying before. The reason for why the 2 meter to 1 meter is being changed is a balance of, if they looked at all the sectors, the economy, and proportion of people that can go back to work, and if you just still maintain the 2 meters, it will be never possible to open any major parts of the economy. So that's the balance of risks. But I completely agree with what's been said before already about the places of worship. It's especially where the infection rate in the community is high, you need to be very, very careful about this.
Fantastic. Thank you so much. I think that's all the questions. Thank you so much. I've got a personal question for Dr. Munir. I don't know if he's still with us. Are you there, Dr. Munir?
Yes.
Just a 95% statistic. This actually isn't a personal question. I promised somebody that I'd ask this question on their behalf. The cut-off time for questions was 12 o'clock because obviously we all had to prepare and so on and so forth. And apologies to all the people, the panel, myself included, we can't see if anybody's putting comments up, we can't see these comments. So sorry if you've got really good questions, and you probably have, and we're not addressing these, we're not singling you out, we just can't see your comments. That's why we kept a 12 o'clock cut-off time for questions. So this person, they asked this question about 95% effectiveness with the Pfizer vaccine. How do we come to 95%? Can we talk in absolute risk terms?
Yeah, so when we say 95%, that means that in the phase 3 trial, the total number of people were 10,000. Half of them, they were given the vaccine, and half of them, they were given the placebo, which is like a saline or anything that is related to, not related to the vaccine, but just as an inert material. So out of those 2 people, they asked them, okay, go and live your normal life. And then at some point, they got the infection, okay? Similar to, for example, anybody could get the. And then after 2 months of monitoring or 3 months of monitoring, they came back and collected the data and identified, right, in the placebo control group, there were 100 people who got the infection, But the people who were in the vaccinated group, there were only 5 people who got the infection. So that is how they calculate that 95% people were protected against the infection.
Really, really good. Thank you so much. Have you guys got any comments before I officially and formally thank you and all that stuff? Anything anybody wants to say?
I just wanted to say a big thank you for the Preston COVID response group, and wish you all good health and peace and prosperity. Thank you.
Thank you so much. Thank you.
Yeah. I also want to thank particularly because it's the first time I came in contact with this wonderful community. I really genuinely enjoyed that. Great stuff.
Fantastic. That's everything that I wanted to hear. I just wanted to be thanked. And I want to thank Dr. Dasu. Couldn't have done it without him. Thank you so much. And thank you to everybody at the Preston COVID response group. Thank you so much to Ayub. Very talented. Thank you very much. And to both of you, Dr. Munir, Dr. Sakthi, very, very busy people. We've been trying to organize this for weeks and probably months, maybe. We've finally done it. Thank you so much. The community really, really value, and everyone's really, I'm getting text messages on my phone, and everybody wants to thank you. And I want to thank you, and thank you to the community for dialing in, and thank you so much. The video will be made available on YouTube. So one of the tech guys will get onto this as soon as the call is over. If there are any more questions, we'll see if we can put a publication out to from the same YouTube channel, but where you've logged in today. Thank you very much. Have a good night. I was hoping Moulana would be here. We'd do a quick dua, but I'll end with stay safe. Jazakallahu khair. Subhanallah wa bihamdihi. Subhanakallahumma wa bihamdika. Ashhadu an la ilaha illa anta nastaghfiruka wa natubu ilayk. Assalamu alaikum.
Assalamu alaikum.